Varicose veins are caused by genetics. In most patients who have varicose veins, they have a family history of varicose veins. They may not be aware whether their father or mother or brother or sister are affected, and sometimes it may skip a generation. And about 80% of patients, there is a family history, but in a small number of patients that don't have family histories, it may even be a genetic mutation. But it certainly isn't caused by a patient's occupation, job, or having children. Those may accelerate the presentation of varicose veins, but they certainly haven't been the cause of varicose veins. Well, varicose veins can present in a number of ways. In some patients, they present with just cosmetic appearances, and that can affect patients' self-confidence about the kind of clothes that they wear. But in some patients, those visible, cosmetically ugly varicose veins can also cause some symptoms. Those symptoms can range from anything to aching and throbbing associated with the veins to even itching, varicose eczema around where the veins are. And in the worst case scenarios, that can even lead to venous ulceration. Well, varicose veins, obviously, in the first instance, are often very visible. So in the first instance, a clinical history and a clinical examination is indicated to identify whether they look like varicose veins. But the stalwart of any diagnostic investigation into varicose veins is a duplex ultrasound scan. A duplex ultrasound scan is a non-invasive study that involves an ultrasound scan and some ultrasound jelly. It can be quickly performed in a clinic location and can help identify whether the visibly cosmetic ugly veins or the symptoms associated with varicose veins are caused by venous reflux, and that is abnormal veins in your legs. Varicose veins should be treated for a number of different reasons, and it really depends upon how a patient presents with varicose veins. If the patient presents with varicose veins with no particular symptoms, but they really just don't like the appearances of them, then it is completely reasonable to treat those varicose veins, because those cosmetically ugly veins can really affect patients' self-confidence. It is also important to treat varicose veins if patients are developing symptoms, because that could be part of a process by which the veins can considerably deteriorate, and part of a spectrum of disease that can lead up to varicose eczema and even varicose ulceration ultimately. So historically, in the past, varicose veins used to be treated by varicose vein stripping procedures. This was a general anesthetic procedure that involved putting a patient to sleep and tying off the vein at the groin level and then stripping out the vein from the leg. This is not proven to be a particularly effective procedure, and the current NICE guidelines in the UK certainly don't recommend this as a first-line treatment. Currently, the most state-of-the-art procedures available for treatment of varicose veins include EVLA, which stands for endovenous laser ablation, foam sclerotherapy, which is directly injecting the veins with a chemical, avulsions, which is a local anesthetic procedure where we hook out the really lumpy veins in the leg, Clarivein, which is a procedure which involves placing a rotating wire into the vein that is affected, whilst also injecting the foam sclerotherapy, and that's as an alternative to EVLA, and also Venaseal, which is glue, which is effectively where the vein that we would be targeting is glued with a special medical grade glue. After varicose vein treatments, the most state-of-the-art procedures that are available, namely EVLA, foam sclerotherapy, Clarivein, or Venaseal, all can be done under local anesthetic in a clinic setting. They don't require any time off work, generally, other than the time to actually do the procedure. And most patients can return to work and their normal activities the following day. Usually, after most of the procedures, patients are required to wear compression stockings, and those compression stockings need to be kept on permanently for at least a week, but ideally 2 weeks. When they take the stockings off, they should not expect the veins to completely disappear, and sometimes the recovery period can extend into months. So it's worth bearing in mind that whilst the procedures are minimally invasive, the recovery period can extend up to 6 to 9 months after the procedure.